Yeah. Amyotrophic lateral sclerosis, it is also known as Lou Gehrig disease sa US. And motor neuron disease naman sa UK. It is a neurological disorder that affects motor neurons, the nerve cells in the brain and spinal cord that control voluntary muscle movement and breathing. As is progressive. Kung kagaya ng nabanggit ni Mr. Tama kanina, progressive, meaning the symptoms get worse over time. So sa paglipas ng mga araw or even months, ay ganun din, palala din ng palala yung symptoms ng tao may ganitong sakit. So, amyotrophic, it comes from the Greek language. At ito yung where A means slow, and myo, it refers to muscle, and eutropic naman, meaning nourishment. So, amyotrophic is no muscle nourishment. So, meaning, kapag yung muscle natin mas nourishment, it atrophies processively. So, katulad sa atin, sa tao, wala tayo natatanggap na nourishment. Ano na lang yung mangyayari sa atin? Maaari tayo magkaroon ng sakit, tulad ng cancer, diabetes, and so on and so forth. So, lateral, it means location. It identifies the areas of a person's spinal cord where portions of the nerve cells that signal and control the muscles are located. As this area degenerates or declines, it leads to scarring or hardening, yun yung sa sclerosis in this region. So, kung mapapansin nyo sa picture, dito sa left side, ito yung normal nerve cell. And then sa right side naman is the sclerotic nerve cell. So dito sa normal nerve cell, muscle contraction. And dito naman sa kabila ay diminished muscle contraction. Kasi nga, when our motor neurons controlling muscle activity are gradually loose, doon nagkakaroon or doon nag-o-occur yung diminished muscle contraction as a result of the impaired communication between the nerve cells and the muscles. Kasi nga yung motor neurons or yung nerve cells, yun yung kumakontrol sa ating muscles. So, yan, si Henry Louis Gehrig, yan, meron siyang amyotrophic lateral sclerosis. And siya siyang baseball's greatest leaders and most durable athletes. Kaya siya tinawag ng most durable athletes kasi kahit nung pinararamdaman na siya mga symptoms ng amyotrophic lateral sclerosis, ay patuloy pa rin siya sa paglalaro. And na-diagnose siya with this disease during his 36th birthday. So after na ma-diagnose siya, nakasakit siyang ganito, nag-retire na siya as baseball player. So next. Ayan, si Stephen Hawking, yung pinag-uusapan naman yun. Yan, na-diagnose siya at the age of 21 of 1963, and he survived for 25 years with a curable condition. And namatay siya at the age of 76. So, sa tingin niyo bakit siya tumagal or nabuhay din 55 years kahit na may condition. Kasi bukod sa mayaman sila, and syempre, mayaman maraming connection, pwedeng padala sa magagaling na and syempre, with the support and the love and care of his family. So, ang na-discover nito is isang French neurologist si Jean-Martin Charcot noong 1869. And became more widely known internationally on June 1941 kasi na ay doon sa pagkamatay ni Luther. Since famous si Luther, ayun, mas naging kilala itong state or itong disease. And yung symptoms naman ng ALS ay muscle twitches and muscle cramps. Katulad ng nabanggit ko kanina, ano yung muscle twitches? Yung siniliti yung nagiging or may nakalala ng doon. After 5 hours of work all day, yung parang natibok-tibok muscles kasi nga na-overwork ay nabanggit ko results. Kaya tight and stiff muscles, muscle weakness affecting the arm, a leg or the neck, slurred and nasal speech. Ito naman yung nagkakaroon hirap sa pronunciation of words, difficulty chewing or swallowing, hirapan na umuyain, tumunog, drooling, paglalaway, speaking or forming words, breathing, unintended crying, laughing, or other emotional displays, and constipation. So, yung most people with us ay namamatay due to respiratory disease. Next. Ayan, ito naman tayo sa cause. Meron ito yung sporadic and familial acts. So sporadic, it occur randomly with no clearly associated risk factors and no family history of the disease. So kahit na may family member kayo na may ganitong sakit, ay very low lang yung chance na magkaroon or mag-develop din rin yung ganitong sakit. 10% lang. Yung familial, also called inherited or genetic, ay yung namamana. Changes in more than a dozen genes can cause familial disease. So about 25 to 40% of all familial cases and a small percentage of sporadic familial and sporadic are caused by the defects in the C9 or F7. So hindi siya kita dito sa picture. So yung C9 or F7 na to, it makes a protein found in motor neurons and their cells in the brain. So kapag nagkaroon ng defect or ng problema dito sa gene na to, walang magiging protein na dun sa motor neurons and their cells sa atin. And another 12 to 20% of familial cases result from mutation in the SOD1 gene. And typical ito. Ayan, ito siya. It is involved in production of the enzyme factor zinc superoxide dismutase. Next. Frequency. It is rare, affecting about 5.2 people per 100,000 in the US population, according to the National Labs Registry. So, according to statistics. And these factors naman niya, unang-una nila yung age. Ayan, sabi dyan, most commonly developed between the ages of 55 and 75, but it can occur at any age. Katulad si Stephen Hawking, di ba? Nagkaroon siya nitong disease na to at the age of 21. Pero commonly developed between the age of 55 and 75. Sa biological sex naman, ayan, lalaki yung more likely to develop kesa sa babae. So, ayun, katulad ng explain ni Mr. Pam kanina, kung bakit lalaki, yung more likely to develop the disease. Pero at older ages, naging equal na. Equally likely to be diagnosed with and race and ethnicity. Whites and non-Hispanics are most likely to develop the disease, but also affects people of all races and ethnic backgrounds. And yung military veterans, kasi nga, they are exposed to chemical toxins or environmental toxins, katulad ng lead, pesticide, then, etc. At meron din nagkakalaan na sa pang factor yung head injury, pero ongoing pa rin yung research or study about if may kinalaman na talaga dito sa akin. And sa treatment, katulad ng dependent disorders, wala din treatment para dito. So motor neurons are pure status time. Pero, katulad din ng iba, meron medications. Yan, una-una na dyan yung ribosome, yung Lynotec, ededragon, sodium phenylbutyrate, and tofersen. So, itong apat na yan, it slows down the progression of this disease. And other treatments, andyan yung non-invasive ventilation, yung pag-amis ng mask sa face and sa nose, and techniques to help increase forceful coughing, mechanical cough assist devices, and breathing staff. And mechanical ventilation, nutritional support from a nutritionist, and sedation. And last, yung feeding tube. So, bakit? Kasi nga, nabanggit ko kanina diba sa symptoms, ay nahihirapan na silang manguya and tulog. So, kailangan nila ng feeding tube. And andyan din yung motorized wheelchair, cane, chest, physical therapy, and speech therapy. Next. Ay, pabalik ko. So, nandito yung amyotrophic lateral sclerosis. Okay, so before I start my discussion, gusto pangalawang genetic disorder, yung severe combined immunity deficiency, I will ask you a question. How well can become any of three different type of blood cells. So, the white blood cells, red blood cells, and platelets. Pero dito sa speed na ito, makafocus na tayo sa white blood cells. So, ano nga ba yung white blood cells? Hindi sa tumawag. Ano yung white blood cells? Yung white blood cells. Para magprotektahan tayo sa so, tama si Miss Sotomaco. Yung white blood cells yung promoprotekta sa atin or it serves as our protection from infections and foreign invaders. So, there are different kinds of white blood cells, including lymphocytes. And lymphocytes ay meron siyang two main types. Ito yung B cells and T cells. Yung T cells ay yun yung nag-identify and identify and kill the infections or foreign invaders. Tapos yung B cells naman, yun yung it makes antibodies that remember an infection and are ready in case the body are exposed to it. So ito yung nag-remember sa ating katawan in case na maka-encounter ulit yung katawan natin ng ganong infection. So, ready na yung pieces natin. So, dun sa picture, siguro kung white immunodeficiency dito sa left side, then it is normal, and dun sa right side is immune. So, yeah, immune system, and then yung pieces, so that the person, the normal person, can fight infections because of pieces and pieces. Tapos dun naman sa kabila, ayun, decreased immune system, at system and yan ang makakasot yung pieces so that cannot fight infections. Walang nagtatanggol na sa kanila from infections. So, ayan si David Becker. Ayan, he is known as the boy in the bubble. And ano nakikita niyo sa picture? Kita ko ayan, basta yung sa picture, para siyang nasa bubble na naman. Below siya, transparent. Bilog siya na transparent, tapos doon siya, baga naka-isolate lang siya. Doon siya nag-i-split. And yun, namatay siya from lymphoma, na-cancer siya from stage 4. So kasi nagkaroon siya ng bone marrow transfusion kasi isa to sa treatment for skin. Pero ayun, hindi natin talaga masasabi na every risk ay may good reward tayo. So next, before I forgot, alam niyo yung was familiar with yung palabas sa Channel 7, yung kawal tayo. Yung nakapanood eh. So, who can tell me the story of yung doon sa part, yung doon sa part na yung bagong bata, si Crescent. Ano yung napanood?
Yung, di ba, kapal sila doon, tapos yung isa parang may ganun na disease kasi bawal siya lumabas, tapos nakikita lang siya sa loob ng bahay. Tapos yung isa naman normal, nakakalabas siya, nakakapaglaro, gano'n.
So, thank you, Ms. Vergara. So, tama yung sinabi ni Ms. Vergara. Di ba, yung kambal, yung si Crescent, di ba yung si Crescent, nasa lang siya sa isang room, naka-isolate siya doon, meron siyang laptop, laboratory, hospital gown, surgical mask. So, kahit gusto niyang lumabas or makipag-video sa mga bata, diba nagsilip siya dun sa bintana? And nakikita niya yung kapatid yung kambal na may nakikipaglaro at gusto niya yun. Pero, bawal kasi it can be fatal sa kanya. Kasi nga, living in a normal environment ay delikado para sa mga tao may skin. And next. Ayan, so naka-discover nito ay si Edward Lanzmann and Paul Drakenberg in 1950. So, ang signs and symptoms naman nito ay yung failure to cry or ito yung hindi tumataba or hindi na yung sa pag-as we age ay dapat tumataba tayo. Chronic diarrhea, frequent cough and serious respiratory infections, oral thrush. Ito yung type of yeast infection sa mouth. And ear infections, sinus infections, skin rashes, laryngitis, and pneumonia. So, ang cause nito ay, meron tayong different kinds of severe combined immunodeficiency. Meron tayong 8 types. So, mamaya, parang dito kung ano yun. And the most common form is caused by G na yun ay yung ito. IL2RG. Kasi kapag nagkaroon ng defects or ng problem dito sa gene na to, walang nagiging protein. Kaya humihina yung ating, or nagiging, hindi, malfunction yung ating immune system. That's why it leads to and X chromosome mutation. Frequency about 1 in 58,000 babies are born with skin gland. So 1 in 58,000. So very rare talaga itong disease. Next. Ayan, yung types. Yung binanggit ko kanina, meron tayo 8 types. X-linked severe combined immunodeficiency, adenosine deaminase deficiency, urinophosphorus Poradase deficiency, reticular dysgenesis, Omen syndrome, Bering Fossite syndrome, Reducing hypertrophy. So, treatment, ayan, hindi siya, katulad ng ibang genetic disorder. Dito, may treatment tayo. At yun yung tinatawag stem cell transplant, or mas kilala natin sa tawag na bone marrow transplant. So, di ba sa palabas, sa sino ulit mga magsasabi sa akin dito? Kung ano mangyari dun sa kumbaga tapos dito sa bone marrow transplant, yung sa namin na si Gerald. Ano mangyari? Natuloy ba yung transplant or hindi natuloy kasi na, right? May ginawa yung yung pangalan. Kaya hindi natuloy. Ayun, nawala yung hope nila na gagaling sa ayan, skin is a pediatric emergency. So without treatment, yung babies na may ganitong disease are not likely to survive past their first birthday. So ang common treatment na ay binanggit ko kanina. And children with SCID usually are cared for by the medical team ng pediatric neonatologist, bone marrow transplant physician, and pediatric infectious disease expert. So, ayan, doon sa discussion natin, di ba, ng kaglag, yung sa gene therapy, ayan, treatment din itong gene therapy dito sa skin. At ayan, si Ashanti De Silva, she became the first gene therapy success story. And siya yung kauna-una naging successful yung gene therapies. Ayan, she was born with a severe combined immunodeficiency due to a lack of enzyme, yung adenosine deaminase. So without adenosine deaminase, her T cells died off, leaving her unable to protect from infections. So dito naman si Agustin, itong nasa gitna. Ayan, he was born in 2010 with X-linked severe combined immunodeficiency or SCID expert. At siya rin yung first to receive gene therapy at Boston Children's. At sa clinical trials, mga trials pa lang, pero naging successful sa kanya. Ayun, mayroon din sa kanya retrovirus and a healthy copy of the gene. And after 6 months, yung T-cells niya ay nag-start ulit na mag-function. Next po. Ayan. So, gene therapy as a treatment for severe type 4 SCID has shown promising results. So, ayun, may napakita na tayong dalawa na naging successful yung gene therapy. Pero, may risk pa rin. Kagaya ng nabanggit ni Sister Pam, may risk pa rin. Kaya hindi na siya widely used. So, katulad kung nangyari kay, ano nga ulit yun? Sino? Yung gene therapy na wrong? Yes. Senior Jess. So, yun, may risk pa din. Kaya, kaya yung gene therapy is, yung research sa kanya is ongoing. Nag-aaral. And yung some children with SCID may need chemotherapy before their transplant. So, kasi sa chemotherapy, di ba, parang release. Para if magkakaroon ng transplant or transfusion, ay safe. So, sa precautions, ayun, katulad nung balik ulit ako dun sa palabas ng mga malalayo. Ayan, place in isolation, kaya nasa siya sa quartz. Nandun lang siya. And should not get diet vaccines, katulad na, ayan, chickenpox vaccine, measles, mumps, and rubella vaccine, oral polio, BCG, and measles. So, bakit sa tingin niyo bawal siyang, not get live vaccines. Yung tao may skin. Oo, tama. Pero di ba yung mga virus ay may, ano ba yung virus na in-inject sa atin? Katulad ng mga, Sputnik, di ba may virus, din doon? Eh, di ba mas kaya nung nasabi ko kanina ay walang T-cells. Walang T-cells. So, oo, isa sa T-cells. So, if na-inject ka ng ganitong virus, ano yung panglalaban ng katawan niya? So, ayun, pwede pa niya gawain.
Basta bawal siya na-expose sa mga ano.
Oo. So, kailangan ka nang nakakulong ka. Bawal siyang lumabas. Saka very sensitive. Bawal siyang lapitan kasi baka ano pwede matingin. And who need blood transfusion must get blood that has been specially treated. So, baka yung nabi ko kanina yung sa chemotherapy. Yun. And if maybe yung may skin ay maaaring mag-stop muna sa breastfeeding until yung breast milk is hindi pa na-check kung malinis ba or to avoid infection. At yung while your child is being evaluated, firstly, help reduce the risk of infection by limiting visitors, avoiding public places, keeping your baby away from anyone with a water infection, and you making sure that caregivers wash their hands well before touching your baby. So, very sensitive kasi talaga. Nagaya na nabanggit ko ulit kanina, ulitin ko lang, even one harmless bacteria ay pwede nila ito. Next po. May comment po. So, bago ulit ako mag-start dun sa aking last, this is the topic ay, may isa ulit akong question. What if I told you that there are rare genetic disorders that affects the way our bodies handle fats? The fats ng cholesterol impacting our various organs. So, tingin nyo, ano yung consequences of these disorders na maaaring meron? Mayroong genetic disorder na yung sa nagme-metabolize ng fat. If nagkaroon ng problema, ano sa tingin niyo yung
Of course, di ba pag nagbibigay ako ng sa medications? So, yun ang mga then,
okay, thank you once again, Ms. Melissa. So, let's explore the Niemann weaknesses sa ating last topic. Next. So, Niemann weaknesses. It is a rare ulit siya, inherited disease, that affects the body's ability to metabolize fat, yung cholesterol and lipids within the cells. These cells malfunctions and over time die. So, itong Niemann disease can affect the brain, nerves, liver, skin, bone marrow, and in severe cases, pati yung lungs natin. Ayan, meron itong 3 main types. Ito yung type A, type B, and type C. Ayan, so type A, onset in early infancy. Kagaya na nabanggit ni Mr. kanina, onset, ibig sabihin, doon mas nag-o-occur na develop. So dito sa type A, sa infancy stage, sa type B naman ay during the onset or yung sa teenage years, sa pre-teen years. At dito naman sa type C, can manifest early in life or during the teen or adult years. So, sa type C, adulthood, caused by deficiency in NPC1 or NPC2 protein. So, mamaya i-discuss natin itong dalawa. So, ang discover nito ay si Albert Niemann, isa siyang German pediatrician, described a young child with brain nervous system impairment. So, later in the 1920s, Ludwig ay pinag-aralan niya studying patients after the death of such children provided evidence of new disorder. So, kaya, nagdoon ang galing itong pangalan ng disease na ito, Niemann. So, galing dito sa dalawang. Next. inherited in an autosomal recessive pattern. So, food transfer. So, ito yung sa father, and ang mother din ay parehong dominant and recessive. So, are ano, so, dito yung sa father, ito yung sa mother. So, are yan. So, dito, since recessive, so recessive father, all copies of the gene must have mutations. So, ito. So, if kukunin natin yung percentage dito, there is 25% chance na magkaroon mo ng nila ng ganitong disease.
Hindi parang parents.
Parang parents dapat ang meron. So, NPD types A and B are caused by missense mutations in the sphingomyelin phosphodiesterase, or yung SMPD1. So, over 180 mutations in SMPO1 have been identified. So, napangalaki 180 mutations. And NPD type C is caused by mutations in NPC1 na matatagpuan sa chromosome 18. And yung NPC2 naman is located on chromosome 14. So, dalawa. NPC1 sa chromosome 18, yung NPC2 ay sa chromosome 14. The mutations in these genes lead to abnormal or defective formation of proteins, which impair the movement of lipids out of the cells, leading to their accumulation. So, ayan, SMPD1 mutation na dito siya. So, sa PR siya. Sphingomyelin. So, punta na tayo sa symptoms. So, kada types na human disease, ay may iba-iba rin ang kanyang symptoms. So, sa type A, large abdomen within 3 to 6 months, cherry red spot in the eye, yung picture na makita nyo sa website. Feeding difficulties, loss of early motor skills, rapid decline in the child after 6 months. So, sa type B, abdominal swelling, may contour in early childhood, no brain and nervous system involvement. Some may develop repeated respiratory infections and breathing problems. Sa type C, abnormal posture of the limbs, drum head, and enlargement or spleen and liver, reduced appetite, abdominal distension, and thrombocytopenia. So next, ayan, napakarami palang symptoms sa type C. Learning difficulties and gradual loss of intellectual activity, irregular speech, clumsiness and problem in walking, sudden loss of muscle tone, impaired movement of eyes, enlargement of bone marrow cavities. Hindi ko po pwede ka ba sa place na to?
Healing of cortical bone, sleep-related disorders, bipolar disorder, and depression, including hallucination and delusion.
So, thank you, Mr. Mac. So, ayan, sleep-related disorder, or yung sleep inversion, ito yung sa physical. At, yung may nice. Ayan, and only one quick disease, it is also known as lysosomal storage disease. So, treatment naman, wala ditong treatment kasi this is pero, merong supportive care na pwedeng sa treatment. Yung try to keep low blood lipids levels. Basta talaga. Gives improving episodes, fusion of blood trials with report, information with healthy SM amount in white blood cells, and by using a blood bone marrow sample, can detect patients' not carriers. And DNA test, para malaman if your carriers ay mayroong type A ba or type B. Sa type C naman, skin biopsy. So scientists closely examine how the skin cells grow, keep track of how they move and store cholesterol, and DNA tested, katulad ng sa type A and type 2. Use centers of care test for prenatal diagnosis, and other tests might include yung bone marrow aspiration, liver biopsy, slit lamp, eye test. So, ayan yung mga nakikita ko sa picture. Ito sa clinic test. Next. So, ito yung mga references na ginamit ko. May ganun. Ay, speech ba? May speech ba? Ay, may outros. So, thank you for listening and exploring the us, skin, and human disease. So,